Hello, everyone. Hope everyone is joining us right now. In behalf of myself, Dr. Elwi from Egypt and Endostar, giving you today's this webinar. I hope you enjoy it and hope the voice is good. Anya, hope and Anita, hope you're hearing everything is all right. The voice is okay. Let's start. My name is Dr. Elwi. This is my second time with you in Endo Coffee in the second version. Hope you will enjoy it. We will speak about the metallurgical point of view in nickel titanium from our clinical point of view and my cases and work. Let's start our presentation. First of all, I want to thank Endostar for this good chance to speak with you, to share our knowledge during this hard times. I feel it's getting better nowadays and everything is getting better, and I hope every one of you is safe. Our subject today as you know, I have been working with Endostar for more than 2 years now. Not working with them, but testing their files. I have my page Timeless Endodontics. I hope you can visit and check my cases and my mini lectures on the page. Our title today is Metallurgy in Root Canal Treatment from the Clinical Approach, which means is our purpose from our webinar today is relevant for clinical endodontics. How come we can connect understanding the dental material with our practice or our daily practice in root canal treatment? As you know, we have a lot of variable instruments in the market from all vendors, all countries, all manufacturers, and as clinicians, we need to understand the different way of manufacturing for better use during endodontic treatment. So combination of files or even using single brand cannot be applicable in all your cases. So if you understand how they made or how they behave inside your root canal system, you can get yourself better and faster results. As a beginning, why we changed from stainless steel to nickel titanium alloy. First of all, nickel titanium alloys are one, as written in the presentation, are one of the several shape memory alloys in the market, but they have the most important practical application in dentistry or medical field as a whole, as biocompatibility with our bodies, corrosion resistant, non-magnetic reaction, and the most two important points that we will speak about them today are super elasticity and shape memory effect. Some people confuse the SE with the SME, or super elasticity, which is pseudo elasticity, with the shape memory effect. In case if you are undergraduate or postgrad, even myself, sometimes you can get confused by the two names. We will focus on them so you can understand how you can get the benefits of these 2 points in your treatment. Nickel titanium alloy, as an alloy itself, it's combined by nickel and titanium. By weight, 56% for the nickel and 44% for the titanium. We can say it's nearly 1-to-1 atomic ratio, equiatomic, but we have to know also that this percentage is sometimes changed by manufacturer to get different behavior of the alloy. according to application that it used in. But mainly in root canal files, they have this ratio. Sometimes they add additives, sometimes they change the percentage to have slight change of the behavior of the wire itself. But to be more clear, this equiatomic nickel titanium have two phases. Okay, we have same percentage, same everything. We will standardize it. So we have 56% weight of nickel and 44 in titanium. But there's two phases, which is the austenitic and martensitic phases. The austenitic, we have to focus starting from this point. We call it the parent phase or high temperature phase, which have a cubical crystal structure. But the martensitic, it's present in a lower temperature phase, like in case of E3 Azure, when you make the file and produce it, it's near body temperature, it's present in this phase. This characteristics of superelasticity and shape memory will be present in both phases, only in the martensitic. But in austenitic, it's only a superelasticity or pseudo-elasticity. Okay? To be more clear, I will speak about it in the next slide, which is some people, when we will see this with this graph, we will say it's very complicated, but I will take my time to illustrate it for you by giving example. It will take us time, but it's very important to understand this graph. If you understand this graph, you will understand how the E3 file or any rotary file behave inside the canal. Okay, we have here stress and strain curve for the austenitic phase. Here, when we start in this point, is the martensitic phase. And also there's a stress and strain curve. The first point we can see in this graph that the martensitic phase can tolerate double the stress and strain, and sometimes more or a little bit less. It's not cannot be calculated because there's a different phase transformation, but still have more stress and strain toleration, more the austenitic. But if we start from this point, which is the martensitic point, the file can undergo deformation within the elastic point till reach here where point for plastic deformation. But in austenitic, you have one point and we can go to plastic deformation, which means file fracture. That's why martensitic files has been produced, not only to pre-curve the file or unaccessible areas to pre-curve it so you can insert it inside the canal. No, only also to take more maneuvers, more curves inside the canal. So here you have austenitic phase wire under heat process. It transfer, we have here AS and AF. This will return back again when we come back from here to back here. But we have here martensitic and start and martensitic finish, which is all the matrix of the alloy, mainly martensitic phase. So when we produce a file from austenitic parent phase and it's stable on the martensitic phase, and you go and use it inside your tooth, it will undergo deformation. Martensitic already as a matrix, it's a twinned phase. So it will go under deformation to detwinned, they call it detwinned phase. So in this case, the file take more force and more deformation and still no fracture. But when you heat back again the file, which happened when we can see it in the manufacturer, sometimes you do it by lighter. But for us, when you sterilize the file, it will return back to austenitic phase, regain back its shape, and the D-twin come back to austenitic. Then after cooling in body temperature on room temperature, it will return back to martensitic phase when we can use it back again after sterilization, and it's still stable, but still can go under curvatures, under deep canals, under calcification. So whenever there is loading, it can take all this load, and in the same time it can deform without fracture, can take more cyclic fatigue, can take more torsional fatigue without separation. I hope you understand this curve. We will go to the next slide. As you see here, to make it more simple, we have the austenitic wires, which cooled will give us the twinned martensite. After deformation during our work, it will be a D-twinned martensite, or deformed martensite, or deformed file, okay? But still the matrix is mainly martensitic nickel titanium, not austenitic. When sterilized, here, come back to austenitic. When you take it back out from the autoclave, cooling near to the body temperature, and when I say here, near to the body temperature, I mean the A3 Azure. Some brands and some other files doing another steps or heat treatment, which I will speak about it later today, that will make this temperature different, which give more phases, more different, we can say more different families from the nickel titanium. They all nickel titanium, but the difference is in the matrix is much different. I hope we pass this part for good, but here I will share with you one experiment I did myself, okay? As you see in the picture, this file is completely austenitic matrix at room temperature, which have only super elasticity or pseudo elasticity, which means you cannot pre-curve inside the canal. So I did here a reverse treatment, severe cooling by temperature minus 100 degrees. I used the Endo ice for a specific time. I pre-curve the file. It retain the shape for a time. When the temperature increased back again, the file returned back to its original shape. But in the same time, I cannot pre-curve it one more time. So what happened here is that due to severe cooling that I did in this area, I gained some martensitic matrix inside the austenitic or nickel titanium wire, but only for a while, because this file is mainly austenitic 100%. But in this picture, same file, I did increase in the temperature. If you want me to be specific, the austenitic phase is present at 1600 Fahrenheit, and martensitic start from 400 Fahrenheit. You can change this temperature so you can get different breeds or different families from the nickel titanium. To remember with me, I want you to remember most of the brands in the market, you have this color, you have some brands have this color, some brands have this color, some like E3 Azura have the blue color. So in this picture, I made a different heat treatment all over the austenitic wire. And I didn't touch the file. And as you can see, you have a different phase transformation. As if you want to see in the next slide, I curved the file, and you can curve it here and keep the shape, gain the super elasticity, and in the same time shape memory. So if you sterilize it back again, it will return back it doesn't mean that this file now turned to be martensite, but this is example how manufacturer can subject the original austenitic parent centered cubic shape to temperature or different temperature or heat treatment process, so can gain different kind of files in the market. In case, as you can see, this one is the blue color. So changing in the heat treatment process can give you different mechanical and metallurgical properties to your nickel titanium wires. So what I can gain from all this data, to simplify it a little bit, super elasticity is mainly a mechanical effect, but shape memory is temperature effect. What it means by these points, when your file is super elastic, it's called also in the same time pseudo elasticity. This pseudo elasticity means when you remove the force from the file, it wants to return back originally to the original shape, not by temperature, not by anything. So this properties make the file a little bit tough, strong, but in the same time, you cannot use it in all the cases. But the shape memory, you can pre-curve and make it according to your case. To show it more for you, I made this picture. No, not this one, the one next to it. Here's the austenitic file. When you make a pressure on it, you can curve it, but when you remove the load, it will return back like this. But martensitic nickel titanium, when you curve it and you remove the load, it will give you the shape. Sometimes when you get the file out of the canal, you can have a 3D image of your canal inside your mind. So that's very good about the E3 Azura. When I do a case and it's severely curved, I remove the file slowly so I can imagine how the file goes through the canal. In the next picture, as you can see here, this is the austenitic file. It's straight, but when you curve it, only you need force to curve it. But after you remove the force, it will return back like this. But in case of heat-treated files, when you remove the load, it will keep the shape, like in this picture. I curved the file on the block, and when I remove the force, it keeps the shape. So this point have a lot of application in our practice. Some people say, no, I use it only to pre-curve the file. No, we will speak about it today. You will get a lot of benefits. Nearly, I use it now maybe in 70% of my cases without any kind of manual files. Okay. Now, I will try to go a little bit slower so I can speak in about some cases and next. Nickel titanium alloy, as I have said before in this picture, if you remember, I want to return back to it. Different heat treatment, different nickel to titanium proportion give you different color, different mechanical properties that impact your work. Only change in temperature or cooling process during production can give a tremendous change in the mechanical properties, not only regarding the design and the taper, but only changing temperature by small difference give new generations of files, which is available in the market. As we will speak right now, the old conventional nickel titanium, which is austenitic, he have only the properties of being super elastic. But our phase, which it's a phase between the martensitic and austenitic, it's super elastic, and they have been able to make the file to be produced by twisting, not by grinding. Many researchers say that the twisted files is keeping the integrity of nickel titanium wire and reduce the micro cracks in the file so it can resist the cyclic fatigue. But it's not applicable on all of the cases, but this is one of the generation. We have also the M wire, which is austenitic, but in the heat treatment process, there's a small amount of R phase and martensitic phase, which have super elasticity and two-stage stress-induced transformation through the R phase, which means that the file can take more curves and can go inside the canals, but still not up to the level of the completely heat-treated file. Next stage, the controlled memory wire, which is martensitic, but have a less amount of austenitic and R phase. It's files that you can pre-curve, but still not to double curve canal, but it can be used, and it's highly cutting, have a high cutting efficiency, high quality files, but it's only one of the generation. Max wire, which is temperature dependent at 20 degrees, it's martensitic, and 35 degrees austenitic. It have both shape memory and super elasticity. Its movement and speed up to 1000 RPM and 1 nanometer square and torque, but in my point of view, it's not cost effective wire file, but it's high quality file and a little bit technique sensitive. I have to undergo glide path with it. So regarding my techniques, I cannot use in most of my cases. The blue and gold heat treated, which have this nice properties. It's very flexible. It's highly resistant, as we talk about the curve before. Have highly resistance because it's mainly martensitic in the body temperature or in the room temperature. So it can resist cyclic fatigue, can resist torsional fatigue up to a limit, and have superior yield strength in relation to the austenitic nickel titanium wires. So we can use it in super curved canals, we can use it in calcified canals, and we can monitor the file during we are work, and we can see the deformation up to the limit, and we can predict what is going on because of this heat treatment process, giving us the super I call it the superpowers. So when you use it many times, you can predict what's going on inside the canal. You can know what kind of forces and curvature the file using the file face inside the canal. I will speak about some cases I started with last year when I started using the E3 Azure. I was a skeptic about using only the Azure standalone in all of my cases. I was afraid to separate a file or to do any mishaps like ledge or apical transformation due to the high cutting efficiency of the Azure. Azure have one point positive regarding its high cutting efficiency, but in the same time, the design, the S-shaped design, it's not a completely radial landed, sorry, but it's centralized inside the canal or inside the root canal system. So in this lower molar, lower 6, as you can see, I went up to maybe 2/3 of the canal third safely with austenitic radial landed file. Then I continue with the Azure. Why? Because I see a sim canal, so I was afraid the stress on the file can give me any mishaps or I separate a file. So I took safety first. As usual, I didn't do a glide pass with a manual file. So when I started with rotary, I started this case combining the radial landed file completely austenitic with greater taper 6. Then I changed to the A3 Azura to remove all the debris that accumulated inside the canal as low cutting efficiency of the austenitic radial land. In the next case, it's a retreatment case, and I removed the gutta percha by radial landed file to mechanical preparation step till the 2/3 of the canal length. Then I continue again, like the last case, with the A3 Azura. I didn't use any retreatment kits because this gutta percha was very easy to remove. Let's come back again to this case. In this case, I was taking my guts at young age and same white canals. So I started also with the radial landed austenitic file, but I found the canal very clear for me. So I stopped using the austenitic wires or austenitic files, and I completed all the case with E3 Azure. I went starting from 35 taper 4, 40 taper 4 up till 45 taper 4. The coronal part over here, I started with 35 taper 6. So I flood the orifice and the bulb chamber with sodium hypochlorite, and I keep my work easily with no manual file. My speed, some people ask me about my speed and torque, is starting from 300 till 350 RPM, my torque from 3 to 3.5. And this is the manufacturer, not the manufacturer recommendation. The manufacturer recommendation for the heat treated wires is starting from 0.8 torque up till 3.5 according to your experience. But we can say safely I use it 350 speed and 2 to 2.5 torque, especially in large sizes. You can reduce the settings in a smaller size, which I will speak about it today. Our next case, which is, it doesn't look like it's severely curved because it's, as you all know, it's 2D picture. It's adult case, reversible pulpitis, single visit, patient in severe pain. I started also without Azure, and I found myself stopping here. I couldn't push the mechanical preparation process with rotary file. Only I stopped here, and for the distal canal, I only stopped here. So all this step from the first and second picture done by radial landed austenitic wires. But in the same times, when I found myself completely stuck, I decided to go for Azure. I changed my size. I was here up to 30 taper 4. So I transferred to 25 taper 4 Azure. Then I continue till I reach to 35 taper 4 Azure. And it was very, very, very nice. Starting from these cases, I become more confident to involve Azure more to the apical 1/3, even in curved canals. And it did very well. In this case, it's a retreatment case. I removed the decay, removed all the dead tissues, and the infection here, it was very, patient have a poor oral hygiene, as you can see here. Also, the 7 is exposed. But I removed the gutta percha with a retreatment kit. But when I try my mechanical preparation, still I used radial landed and austenitic wires. But in the same time, I couldn't reach the remaining working length. So I continue after removing and copious irrigation all over the canal. I continue my work with only E3 Azora. I didn't use C file to open the calcification or anything. Just I do a crown down technique. So I return back to 35, 30 till 25 taper 4. Then I return back again to 30 taper 4 by E3 Azure. So in my office, I have the all three kits, the basic, small, and big, for all this situation. Um, this is what's going to happen if you understand how your file behave inside the canal. Because I wasn't afraid that the file have a detwinning or detwist, because I understand it can take more force. So I will speak to you, I will simplify it in the end of our slideshow today, how to be safe during this procedure by using only the E3 Azure. Um, some cases here, actually, in the presentation, I cannot show because they are, yeah, it seems I cannot show because they are in one slideshow. But as you can see here, this premolar, this 1, 2, 3, 4, 5 cases, but it seems I cannot play. But I will speak about this premolar. As you can see, this curvature, it's not hard curvature, but when you do it with only rotary, you have to understand how to do it without going here or do strip perforation. Simply, I go with the 35 taper 4 till the point of resistance. Then I go 30, 25, then I can go back again up to 30 and 35 easily without using manual files. In this case, particular case, completely by E3 Azure last year. Our next point is very important because I will let you understand more about what you can get from heat treatment for these wires or these files. The heat treatment process for the E3 Azure give it the blue color. They don't paint the wire to be blue or to be have this unique color. Um, this heat treatment process give you the benefit of controlled memory. Okay, from a beginner point of view, I can get benefits of pre-bending, limited mouse opening. I can introduce the file inside the canal easily. This is one point. But for a professional or for people who you keep using the E3 Azure, it have many other points that will enhance their quality of work. First of all, you have to understand the E3 is grounded before they go to the heat treatment process. So it's a post-machine heat treatment process. What I can get from this equation or this process, that the post-machining heat treatment have two benefits. Benefit number one, or what I get number one, is this coating or heat treatment process. Um, let's speak about it in the next slide. Make a titanium oxide layer over the wire, which can compensate the loss of strength of the austenitic phase. When you transfer from the austenitic to martensitic, austenitic wires is very strong, but it's not resistant to cyclic fatigue, because when it go beyond to plastic deformation, there is no space between plastic deformation, or when it started deformed, it will not go back again to the shape that it lost. You have to discard the wire, discard the file. But the heat treatment for the E3 Azure, uh, when when the file is deformed, it can return back to the original shape after sterilization. So, but in the same time, you lost the strength. That's why sometimes I use higher sizes in the E3. But this titanium oxide, which gives a blue color on the surface, it, number one, compensate for the loss of hardness, increase the cutting efficiency and wear resistance of the file. So when you sterilize it for many times, it keeps cuts like you get it new from the box. For sure, not for a lifetime, or we will not buy a lot of files as we need in our practice. But in the same time, its cutting efficiency is proper to use during our work. So you are 100% sure that you remove the debris and you cleaned. The points that I was talking about, it have better fatigue resistance and in the same time flexibility due to martensitic matrix. The last point, superior cyclic fatigue resistance compared with conventional nitrile. As I have talked about in the beginning of our webinar, if you see the curve here, I will return back again to it. Okay. When you are in this phase, you have superior stress and resistance to the martensitic. It's twinned and detwinned back again and change in the matrix. And these properties of the matrix of the martensitic or the nuclear structure of the martensitic phase, which give it this properties. So these 4 points and add on them, when you have more martensitic nickel titanium alloy, you get more flexibility, more fatigue resistance, which means that the file can be deformed and detwisted and recurved and take double S shape more than austenitic nickel titanium wires. You cannot go with size number 30 or 35 in S-shaped canal, which with a wire have more austenitic phase than the martensitic. Even the other brands and other companies which make a combination between austenitic matrix and R phase and martensitic matrix, it's good files, but still cannot undergo all circumstances. The second point, as I said, the E3 is well centered inside the canal. So when you are in a curve inside the canal, the file will not make or undergo altering in the natural canal anatomy. The last point, it's not for me, but some people ask about it. Can I use the E3 or the blue heat treated wires in both rotation and reciprocation? And the answer is yes, you can use them in both. But this is not because of the E3 only. All the technology of heat treatment in the blue wires, uh, which is rich in martensitic phase, is applicable to be used in rotation and reciprocation. And the answer for this, if you say why, because it can take all the forces that distributed on the wire. But the main point, whatever it's rotation or reciprocation, you have to take care 100% to observe the file in every stroke. And when you remove it inside the canal, check the file during your operation is one of the most important points during your treatment, because it will give you idea about what's going on and when to discard the file. uh, in case of E3, not to discard, just to clean and sterilize and not use it right now, because when you sterilize it, it will return back again to the original shape. Okay, some manufacturers say I use it in this number of canals, but I will speak about it in the end of our webinar today. This is not how it's going on. But in the same time, when you check the file during operation, it will reduce the chances of file separation inside your canal. Our next slide, I will show you two cases. The people of Endostar know that yesterday it was a very tough day for me. I have a lot of cases, a lot of work, maybe for continuous more than 8 hours. I will show you two cases completely done in around 30 minutes. uh, with no manual file, with no radial landed files, with no other file except the A3 Azure. In each case of them, I used only two files. Some people, when they understand their file and understand what they have in their drawer in the clinic, can take out a lot of file. But some practitioner, this is not the point. Some practitioner prefer to use only one or two files to be fast and not to be hectic. So for these people, I will show them these two cases, one lower molar and one upper molar in the next slide. The first one, we have a lower 6, lower molar with irreversible bulbitis, 4 canals, curved mesial canals. Uh, Given the anesthesia, nerve block normal, remove the caries, gain the access. And when I started with file 25 paper 6 Azure. No orifice opener, no manual files. The canal wasn't that much wide, especially in the mesial canals. When I used the 25 paper 6, it was very easy here in the second picture to reach up till this point only. But later on, I cannot go any way more. And the apex locator keep telling me I still need around 2 millimeters in both canals. Here you can see it's only one canal, but there are two canals, as we see in this picture. So in this point, I decided to go for a smaller file, which it's not resistant to forces, especially in the apical 1/3, but in the same time, it can go to the curvature, which is 25 taper 4, not taper 6. So it was very easy for 25 taper 4 to go with no force in this area or pressure from the to structure on the file, because the previous file was 25 taper 6. So I can easily go to the proper working length, which confirmed by the X-ray and the apex locator, and I get this results by only two files. And by the way, the patient is not young age, he's above 50. So the mesial canal wasn't that much easy situation, but done only by two files. Let's go for the upper 7. As you can see, here is the exposure. Nearly no canals, or the canals is hair, like hair. You see, it's very slim. In this case, I didn't take the risk and start with taper 6, especially for the working length was nearly above 23, 24 millimeter. So I started with 35 taper 4. What I get benefit from 35 taper 4, it's the canals are not severely curved, but in the same time, the 35 taper 4 E3 Azure have a wide core. The core is big, so it can resist more forces impacted on the wire or the whole length of the nickel titanium. Then I go back to 30 taper 4, irrigation all the way, continuous irrigation. I never stop irrigation. And by the way, sometimes if you leave the sodium hypochlorite inside the canal for 1 to 2 minutes during your treatment, then clean it, then put again fresh sodium hypochlorite. So I combine sodium hypochlorite and saline. Then again, I put a fresh sodium hypochlorite and combine this protocol with the ultrasonic tips. The sodium hypochlorite become very effective when you change the freshness of the sodium hypochlorite inside your canal. I don't leave it for a long time to 15 minutes and don't change. No, I have to clean it with salines, remove the debris, put a fresh sodium hypochlorite back again. Then I return back again with 35 taper 4 and I finish my case. So I hope you enjoyed this webinar, but I have one slide for you. It's combination about the knowledge that we have to our books in our books and my clinical preference. Um, when you open your Access and have a flexible file in a severe curvature, um, it's very good to use larger size for flexible files in the canals. Why? Because you can take all the curvature, but the stiffer one, you can use it for straight canals. This points you can apply it. Okay, I have a central incisor. I can use larger taper and stronger file for a straight canal. But also in the same time, in curved canal, I prefer to start with stiffer files up till the curvature point. Before the curvature point, try to get the benefit of the stiff files, because the stiff file can give you brief layering, and as I told you, I prefer crown down, so I use large ISO size, larger taper up till the point of the severe curvature. Then later on, the process will be much easier for the non-stiffer or smaller sizes wires, which in the second point, it's the same. You can secure your glide path by extra torque on the files, which only can be applied, whatever the brand you are using, by higher ISO size and higher taper. This point, which I intend to say or talk about, this is about manufacturer recommendation. They say you can use the RPM and torque as recommended, and don't use high RPM for curvatures. This is my point. Manufacturer recommendation must be admired, but in the same time, don't introduce smaller ISO or smaller taper with high RPM in the curvature points until you pass this curvature. Later on, you can do whatever you want. Just pass this curvature or severe curvature. Monitor the file before reuse. This is a good point. The manufacturer give us, we can use this file in all this number of canals, but also it's your own responsibility to monitor your file. But in the same time, you have to understand there is no safe number. You know when you use this file, in which calcified canal, in which curvature, with this patient. So if you use this file for most complicated case, so try to reduce the numbers that you use this file in. This point is very important. The radial landed files movement is picking motion, but you can get benefit from the E3 or the heat treated file in a brushing motion in non-landed files, and in the same time in the heat treated wires. This point I have talk about it here, that the small taper is very good in application in severe or acute curves. The last point, which leads to my technique, always practice hybrid instrumentation. It doesn't mean that I say E3 Azura is the best. Yeah, it's the best for me now because I keep training how to use it standalone, because I don't like to use manual file. But try to use E3 Azura, combine larger taper with a smaller taper, starting from ISO 35. See what is suitable for your maneuver, for your techniques. Okay, so when you face a complicated case, you know which file to start with. And also try to make sure if the case can be done in a single visit, try to finish. It will give you higher success rate. I hope it wasn't boring speaking about metallurgy today, and in the same time talking about case and talk about manufacturing process. I hope you enjoyed. You are more than welcome to have any questions anytime today, after this webinar, or later on. I'm always with you. Every one of you know when can contact me. Um, Today, my advice to you: a smooth sea will never made a skillful sailor. So if you didn't face hard cases, hard curvature, calcified canal, uncooperative patient, in the future you will not reach where you want to be. Um, Endodontists work inside the clinic. Nobody sees the quality of work. We are not like prosthodontics, like implantologists that put their pictures online for a smile design and aesthetics. Um, Bad news for us: we are not well appreciated, but we are well appreciated by our patient to reduce their pain. So try to work hard to test and try different files. In E3 Azure, I tried to work in extracted tooth many times, standalone, to reach where I am right now. Seems something wrong in the connection. And I hope to see you in our next webinar, Endo Coffee. It will be with Dr. Vaktar and Dr. Modi from India. They will speak also about the multiple curves and how they manage. Hope you enjoy it. It will be June 9, and come back again here and keep in touch.